All right, so today's Catherine's big day. She wants to have her upper eyelids done, so we're doing an upper eyelid blepharoplasty today. So she's going to be awake for the whole thing. We gave her a little bit of oral hydrocodone and Valium just to help her relax a little bit. She just took it a little while ago. So I'm just going to do some markings and then we'll head back and do the procedure. So, any questions, Catherine?
No.
Okay.
I'm all in good hands.
Going to show. Go ahead and close your eyes. So I'm going to lift the eyebrows so you can see the amount of skin that I'm removing is pretty clearly marked there, and the spinal incision is going to fall in this lower crease here at the bottom. So that's where, when she opens her eyes, go ahead and open, you won't really be able to see the incision unless she were to close her eyes and you'd see a very fine line. But that's about the amount of skin that's overhanging where I remove. You just take slow deep breaths, and I'm going to go ahead and give you a little needle right here. So the key is we just inject really, really, really slowly. How are you doing, Catherine?
Good.
So once I inject her, I'll let that work for a few minutes, and then I'll prep the area with some betadine and cleanse it. And after I do that, then we'll go ahead and start the procedure. But okay, so we just finished up Catherine's upper eyelid blepharoplasty, which she just finished doing awake in the office. And how was it, Catherine, first
It
of
was
all?
great. So,
Tolerable?
very tolerable.
I numbed her first, and then we laid her down and did the procedure. And it took a total to numb her and do the procedure just under an hour, basically, did everything. So if you look in here, you can look at the camera here. You go ahead and close your eyes, Catherine. You see she's a little swollen in the upper eyelids, and that's normal. That's from the injection plus the surgical trauma. She has the suture line going all the way across here and all the way across here. You can open your eyes. So she can open her eyes right afterwards. How's your vision?
My vision's actually great.
It's not too blurry or anything?
No.
So it's going to become, this area here is going to get a little bit more swollen by tomorrow, but she's going to be icing it tonight and tomorrow. And then over the course of the next 1 week, the swelling is going to improve dramatically. It's going to become maybe little shades of yellowish green, but very minimal bruising at that point. And then in about 6 or 7 days, we'll take out these sutures in the office, and then that incision will just blend in over time and just be a very fine line. So, great job, Catherine.
Thank you.
Okay, all right.
Thank you.
Good job.
Yay.